Hey everyone, welcome to today's show. And today it's going to mean you're going to take a step back in time. And what do I mean by that? This is when we start to put things out there that you have to start to like, oh, I forgot all about that. Wow, I didn't even like where has that been? And we're also going to tell you how that now is impacting your life as you know it today. And so, my guest, Dr. Melissa Goldberg Mintz, is a clinical psychologist and author of the upcoming book, Has Your Child Been Traumatized? How to Know and What to Do to Promote Healing and Recovering. And we're going to take a step back, not just about your children, but about you. So, this is going to be key takeaways if you've ever thought, like, hey, why am I like the way I am? So, Dr. Melissa, welcome to the show today.
Thank you. Thank you so much for having me. I'm so excited to chat with you about this topic.
Well, and it's one that we're hearing more and more these days. And it's almost, it's come to this realization that we no longer can just, kind of sweep things under because those, gosh darn, as I call them bugs, beliefs underground surfacing, they end up coming up at the most inopportune time, right? They sneak through the door holes, they sneak under the door. And then all of a sudden you just wake up one day and you're like, why? Why did I react that way? Why did I do that? So help us understand what is going on in today's world around specifically this, and how did you get into this with your own relaunch?
Yes, absolutely. Well, I love how you put that. It reminds me of a metaphor that I often share with my own patients. And that is that the things we don't want to deal with, it's kind of like a beach ball in a pool. And I don't know if you've ever had a beach ball in a pool before. Perhaps you've tried to push it under the water. So, what we know about that is that it takes all of our energy and effort and concentration to keep these things down, to sweep them under the rug or push the beach ball down. And no matter how hard we are trying to keep that under the water or how diligent we are about sweeping it under the rug, it doesn't like to stay there and it'll come flying up out of the water. And the work of therapy is letting some of the air out of the beach ball and talking about those things, making the space for them. And when we think about relaunching, oh my goodness, it is just so critical to have space to process what happened to you that's holding you back.
I like that whole visual of that beach ball, because you're right. It doesn't just come out in a slow way. It's like you push it down and it just shoots out like a rocket, right?
Right.
And so your relaunch to even get you into this was, can you share your journey here? Because this is some heavy duty, we're going to go into inner child, we're going to go into all of this, but what made you want to really go into this line of work?
Sure. Yeah, absolutely. So, let's see. I, growing up, had a childhood friend who experienced trauma herself. So, just lots of different types of trauma, including sexual abuse. And this was a very close friend of mine. And no one around her knew how to help. And gosh, it was just very discouraging for her. And I also felt powerless. So really just wanted to understand what was going on for her, and also learn how to help. Also, I think I just had this question. Once someone has been traumatized, is that sort of it for them? Are they damaged for the rest of their lives, or can they heal? So I think I was very curious about answering that question.
And I think that as we go on here, I think that it is a valid question, because sometimes we think that we are damaged goods and we don't want to talk about it. And so your friend, it's impressive that she even talked to anybody, right? Because a lot of times as children, we just keep pushing it and we don't want to bring it up. We're embarrassed. We don't know how people are going to react around it. So as we go forward, can you help us understand, is this something that you really can eliminate?
Yeah, so I want to say just unequivocally, yes. So healing is not only possible, but the majority of people who experience some type of adverse event, whether it's something like sexual abuse or something like a car crash, the majority of people do go on to heal and recover. So, yes, and I would say that yes, it is possible for everyone.
And so in your experience, you had this major relaunch happen when you were young, and you watched this friend of yours go through this. How did that impact you as you got older?
Sure, absolutely. Well, I think that so thinking about graduate school in psychology, there are so many different things that you can specialize in. I mean, there are people that like working with adults, people that love working with teens, young children, people that love treating depression or anxiety. And I really felt myself drawn to trauma work. I think, in part at least, due to my early experience of watching my friend who had been traumatized.
And so when you talk about, or when we hear inner child,
Mhm.
the inner child, for those that don't know anything about that, is this something that, is there really an inner child? And what exactly does that mean?
Sure. Yeah. Wonderful question. So, this is something that a lot of therapists talk about in therapy, particularly around the topic of shame, shame and self judgment. So, I think that, as adults, we can be so hard on ourselves, particularly around issues of shame. And there can be just a lot of like inner self criticism. And one way to look at that from a different perspective is to think about yourself as a child and to think, this is who you're talking to. I mean, yes, you are the grown up adult version that you are. And that piece of you from your childhood that is still alive and well and informing decisions on a day to day basis.
Mm, that is, we discuss this quite a bit with bugs and with the belief blaster, and trying to understand that, hey, your subconscious never is letting it go.
Mhm.
You may think
Right.
like, again, shutting those doors. What are some of the childhood traumas that are the most common? So if people are out there listening, like, I really didn't have any childhood traumas, that's not me. Because it was interesting when I did my book, I interviewed a bunch of different people, and one of the gals said, one thing that I think her name is Britt, and she said, and she's a therapist, and she said, you know what? Here's the thing: we all have trauma. It's just some of us don't label it that way, because in our families with our stories, that isn't a big deal. So we all of a sudden realize, we wake up and we're like, wait a second, is that really trauma? Did that really happen? So I'd love to know, what are some of these traumas that people are starting to realize, yeah, that is a trauma.
Yes, absolutely. Great question. So, first, I'll just clarify a little bit about the difference between trauma and adverse events. So, the adverse event is the thing that happens, the thing that was scary or terrifying. And then trauma is what happens in your body after that. They often go together, and sometimes when we're thinking about resilience, adverse events don't necessarily every time result in trauma, but types of adverse events that can and do often lead to trauma. Um, things like being separated from a parent for a certain amount of time, or having a parent be sick, a parent struggle with drugs or alcohol, divorce and separation, as well as things that you might traditionally more think of as being trauma, like witnessing domestic violence, sexual abuse, physical abuse, witnessing community violence, all of those sorts of things. And then, of course, like I hear very many just sort of one off examples of things that would count, like being attacked by the family pet. That could result in trauma. Being thrown into a pool at a swimming party and not knowing how to swim, that could also result in trauma. So
That's definitely problematic. And that dog thing, I have to tell you, very interesting. And I'd love to get your take on what happened. I was hiking with my husband, Eric, and two dogs come just racing at us. And there's really nowhere to go, but there's a log. He jumps up on it. I try to climb the fence. And of course, I'm in such a state of panic. I slip. I go crashing down. He then is trying to kick off one of them. One of them is a pit bull. And so I'm not saying I actually have family members who have adorable pit bulls, but this one was just going like a bit through my husband's shoe. And it was really interesting that from that point, I've had these dog like nightmares, and it's triggered something in my childhood where I was standing at the end of a dock holding my little teeny like Shih Tzu, and all of a sudden this gigantic dog comes like racing down the dock right at us.
Oh.
And I mean, there was a point where I'm like, do I jump in? Like, what do I do?
Right.
And I'm kicking at the dog, and it was just a terrible thing, but it made me realize, it brought up that memory that I had just pushed down. So does this happen? Like people later in life because your list was so long, right? Separated from a parent, somebody's sick, drugs, alcohol, divorce, domestic violence, community violence. I mean, there's so much there. Can something in our lives as an adult actually trigger us to remember? And I loved how you just described the adverse event is the actual event, and then the trauma is in the body of what comes after. I think that this is such a fascinating conversation. So how does that all work together?
Yes, absolutely. So that can and does regularly happen. And I'm so sorry that you experienced that. That must have been terrifying. Ooh.
Both of the experiences were
both of them. Yes.
And I'm giving like a very high level one because it literally just happened. So I was like, but there are others that I have noticed too. So this is, starting to happen more as I reach, I'm in my mid-zone of life.
Yes. Oh my goodness. Absolutely. So, lots of different things going on there. So, first, what we can talk about a little bit is what is happening in your body when you are having those nightmares or having those, we call them re-experiencing symptoms. So it's like it's coming back to you. So where that is stemming from is your body is trying to keep you safe. So we think about something called our sympathetic nervous system. And so that is the part of our body that is responsible for, I'm not sure if you've ever heard the term, the fight or flight response. Now, fight, flight, freeze. Yeah. So that is what gets activated when we feel really scared by something, and it gets our blood pumping, our heart pumping. It gears us up. So if we need to fight something or run away from some giant pit bulls, like you got that juice in your body because that system got revved up. And because that system got activated, it brings up some other things too. So when we think about symptoms of trauma, and let me clarify, I'm talking about trauma a lot. So most people have some symptoms of post-traumatic stress, but we're not going ahead and diagnosing people with PTSD or anything like that. So when you're having, if you just have nightmares or something like that, you can still be perfectly normal, perfectly healthy. We're not talking about slapping a diagnosis on you or saying you need therapy.
So I don't need to check myself in right now. Not yet. Although, my family members and friends might say maybe it is time, but not quite yet. Okay.
No. No. And we can talk a little bit later about like when it might be time to find a therapist. But, having some symptoms like that, especially after experiencing terrifying like you had, it makes total sense. And it's your body's way of keeping you on edge in case there are threats that are going to come. So your body got revved up when those dogs were chasing you, and that helped keep you safe. Your body's still a little bit scared, even when you're, safe inside your home. dogs aren't going to come breaking into your house and attacking you, but your body remembers and your body's still a little bit on edge. And again, this really just stems from this evolutionary response of our bodies are hardwired to keep us safe. And you got really scared by this terrifying thing that happened.
And so let me ask you, so can childhood trauma impact day-to-day life as an adult? I mean, is this something now that potentially will, recur? Like I'll see another dog and if it's coming at me, I'll be like immediately go into that fight flight state.
Yeah, I would say it's definitely possible that something like that would trigger your symptoms. And I'd say for people who do have what we call more clinical levels of post-traumatic stress, it might not even take that. If somebody's got some unresolved trauma, and it's really weighing on them, they can be triggered by, even just hearing a bark on TV. So even if they're just safe in their home and they hear a bark on TV, that could be enough to trigger that fight or flight response. Their hearts start beating really fast. Maybe they start sweating, shaking, trembling, things like that.
Well, it is, and when you think about it's such right now in these uncertain times where when you said uh, the domestic violence, I
Yes.
know that recently I heard a horrific study that was done that was testing that. And I know that you actually know quite a bit of this. We're about to go on a break, but when we get back, I would really like to understand what is happening around the domestic violence and how that can be impacting kids in homes and how as a parent, if we're the one being attacked, what we can actually do to help our children and that inner child. So when we come back, we'll dig right into that. So don't miss out. Don't be gone too long. Just hang tight and we'll be back with Dr. Melissa. This episode is brought to you by my very own labor of love, my most recent book, ReLaunch. This book is a collection of my stories, other stories, and is a motivational guide to living a new 3HQ lifestyle, sparking your heart to ignite your life. It's available for purchase via Amazon. Get ready to try on the 3HQ method that I've been using for years throughout my entire life, reaching the next level in all areas, both professionally and personally. Get your copy today at www.therelaunchbook.com. Hey everyone, I am here with Dr. Melissa Goldberg Mintz, and we are talking about trauma, but childhood trauma. And as we were taking a break, I said, there's been some really awful things that have come from COVID, in addition to people getting sick. And domestic violence is something that we're going to be talking about and what's causing it to be on the rise and how this is affecting one as an adult who maybe has experienced this as a child, but also the child in the house. So, Dr. Melissa, thank you again for being here. And I know that, this is a topic that we do not want to discuss because it's so uncomfortable, but it is a topic that we cannot not bring up. It's that important that we all know so that we can help do something about it. So, Dr. Melissa, tell us, what is this, what are the statistics that are happening out there around domestic violence?
Oh my goodness. Yeah. Well, thank you for having me. And that is a very tricky question because domestic violence thrives in secrecy. So it is impossible to know the true rates of domestic violence going on right now. What we do know is that since the pandemic started, while certain types of crime decreased, which was wonderful, domestic violence was one that really went on the rise, with people being trapped in their homes. There are so many stressors going on with the pandemic. I mean, financial stressors, especially within the first year, and many people losing their jobs and just the increased stress in the home. And so sometimes with losing jobs, that comes with vulnerability to abusing substances. And it's just this sort of horrible storm of stressors that might make a family more vulnerable to experiencing domestic violence.
And Melissa, Dr. Melissa, are you thinking or are you experiencing that? Is this men, women, children? Is it happening to all three? Is there one group that's being more, predominantly like addressed in this horrific, increase?
Yeah, so I would say it's happening to everyone. One distinction I have is that when children are being abused, we might call that child physical abuse. But when it happens between partners or spouses, that would be, boyfriends, girlfriends, things like that. That would be domestic violence. And again, so hard to know rates, but what we know is that certainly in terms of crime reports, higher reports of domestic violence between partners living in the home. And then for children in witnessing this domestic violence, which is an adverse event, even if no one touches them.
Well, and you discussed that before that trauma is a cause, it's an effect of
Mhm.
this adverse event. It's something that
Yes.
then trauma happens in the body. So when we have a trauma, and whether it is domestic violence or whether, as you said, with children, that are they're witnessing it or a part of it, this is a deep-seated trauma, and that can, we could suppress it. What happens as you get older? What are you seeing that, comes up for people that have had these major traumas in their life?
Sure. Oh my goodness. So people take it all sorts of different ways. It depends on how they cope. For some people, for some kids who witness things like that, they might decide relationships aren't safe. I'm going to go it alone and not seek out romantic relationships or even friendships because relationships feel scary to them. So some people might go that route. Others might be drawn to the familiar. There's this saying in my field, you do what you know.
Mhm.
And so if what you know is physical abuse and domestic violence, that feels familiar and that feels more comfortable to you than it would if you grew up in a home without that. Another thing I've seen is people getting together with partners who maybe aren't physically abusive, but are sexually coercive or even emotionally abusive. And they think, well, he's never hit me, she's never hit me. So this is a good relationship. Your reality is skewed by what you experienced growing up.
So that's a great point because emotional abuse can be just as traumatic and cause just as much trauma as the physical. And
Yeah.
we don't think that. A lot of times we think, oh, we're weak. We're like, I'm so sensitive. I just shouldn't let that bother me. But especially when that happens when you're, under that 7 to 8 year old, where you're just being blasted with it, that you're no good, you're, you know, not worthy, or all the things that we are so inclined as human beings to want, right? We want to be loved. We want to feel like we belong. We want to feel like we are good enough. And so, can you walk us through a little bit that if indeed you have something like this, are these people traumatized that have been traumatized, whether it's emotionally or physically, destined to struggle with mental health symptoms for the rest of their lives?
So no, not necessarily. And I don't think it makes someone better or worse if they do or if they don't. It sort of just is what it is. But what we know is that, particularly if while experiencing adversity, somebody had at least one secure attachment relationship. So, what that means is just someone who they could reliably count on to take care of them just consistently, that would do a great job in protecting them against some of those manifestations of post-traumatic stress. Now, that's not always the case. Someone can have that and still go on to develop those symptoms. But what we know is that that's a protective factor.
So are you saying, Dr. Melissa, that this is a person that as they're going through it, or this is a person as an adult, if they have somebody that is a secure relationship for them, that they can then handle some of these emotions that come up?
Yeah, so I meant as a child, but
Okay.
now that you say that, I
Yep.
think having a secure attachment relationship as an adult, either with a close friend, a partner, anybody, that goes a long way in helping us regulate our emotional distress.
And so talking, why do they always say keeping it in is like the toxin?
Yeah.
Letting it out really helps to create your pathway to a better future. What is that? How does that relate to what we're talking about?
Oh my goodness. I love, yeah, that is spot on. So it's like the beach ball in the pool we were talking about before, or, say you fall off your bike and take a spill and cut your knee open. You know what you got to do. You got to clean it out with some alcohol or some soap, something sterile to keep it from getting infected. And that doesn't always feel great. And what we know is that that is how our wounds heal and how we prevent infection. And so holding things in are just sort of like that, and you're getting infected. Yeah, we don't want to bottle these things up. And of course, that's what people generally do. It feels more comfortable. And we do have these thoughts like, oh, I should be over this, or that wasn't that big of a deal, or I shouldn't be so sensitive. But what we know is that those type of thoughts are what get us stuck in our recovery and keep us from recovering.
Mm. So let's talk about this because this is so fascinating to me in regards to letting go of the past. And I talk a lot about your bugs, these beliefs underground surfacing. And I have a process called the Belief Blaster that I take people through, and it's neuro based. It takes 67 days to synaptically prune, which means basically you're breaking down that limiting belief so that you're creating a new empowering belief. But what about, like, how are you recommending to truly be able to let go of the past when subconsciously it's still there? What can we do?
Yeah, yeah, I love that. So I think the first part is realizing, this is always going to be a part of your story. This is always going to be a part of your history. And if you want to picture something in keeping with this wound metaphor, we want to go from like an open, gaping wound that's just raw and painful into a scar. So it's always going to be there. If you look for it, you'll always be able to find it. And it's healed. So I think that's the first thing, is accepting, like, it's not going to be like one day you're done and, you'll never think about it again. So realizing like, yep, this is always going to be a part of my story. And like, I can still heal from this.
Mm, yeah. And so you decided to take this even further and you wrote a book. And the
Yes.
book is, congratulations. I
Thank you.
understand there's some exciting news that it's coming out tomorrow. So by the time people really listen to this, this is going to be like, it's out, it's there. And it is, has your child been traumatized? How to know and what to do to promote healing and recovering. Can we talk more about this important subject and why you thought it's time to write this book right now?
Yes, absolutely. Thank you for asking. So, there are so many amazing books out there about how to raise resilient children, which is such an important topic. I've read many of these books. I recommend them to my own patients. And when it comes to how to parent and how to support a child that's already been traumatized, there's not as much out there. There are some books out there, but they're very specific in dealing with certain populations. I wanted to write a general book for parents, because there also are a lot of books out there for therapists telling therapists how to help traumatized kids. But I wanted to write this book for parents, just given what was going on in the global landscape. just so much adversity in the world right now. And I wanted parents to know there is still so much hope for children. They don't all need therapy. What they do all need is a warm, supportive relationship with a caregiver, whether that's mom or dad or a grandparent, a foster parent, aunt, uncle, whoever it is. But every child needs that.
And so, what's the best way to harness a relationship to really foster something that, they all need this very supportive? And if there is, trauma that's going on in their body and there's been these adverse events and potentially, as you said, divorce, and my parents got divorced when I was about 4 years old, mom and dad are going through their own thing.
Mm-hmm.
So what's the best way to really help foster a relationship that would be supportive?
Absolutely. So I break this down in my book about very specific ways to foster this relationship. But my number one go-to intervention for this has always been and likely will always be quality one-on-one time between parent and child. So gosh, I just think there's no replacement for this. I know this can be hard, for working parents or parents of multiple children, parents who have a lot going on themselves. And it's so critical, not just to fostering the relationship, but also to building self-esteem in your child. So, quality time can be anything. It can be baking cookies together. It can be taking the dog on a walk. It can be, watching a TV show together, provided that you're, side by side talking about what's going on. But the most important thing is that it's just the two of you doing something together that you both enjoy.
And you mentioned building that self-esteem.
Mhm.
Is there a point where building self-esteem is super important in certain age groups of children, or is this something that, I've heard, the decision making of brains, it's really early 20s when that's finally
Yes.
developed, right? Something like, that deductive reasoning happens. Is self-esteem something that really forms as a child?
So I will say yes to that. And I would say, even if you have a perfectly confident child who, grew up with all the confidence and self esteem in the world, if they experience something scary enough, their worldview is going to be totally shaken. So it would be normal that even if they grew up very confident with very high self esteem, that they need a boost after something terrifying happens. So,
And
yeah.
what's interesting about that? It's always fascinating to me that the ones that look like they've got it all together
Mhm.
on the outside are the ones that are really struggling on the inside.
Yes, yes, absolutely. Yeah. Oh my goodness. And for some kids and for some adults, that's how they cope. That's what makes them feel better. To put together a very strong, confident outward persona that makes them feel better about the chaos inside. And we don't begrudge them that. It does feel good to have people perceive you, and that you're someone who has your stuff together. This is a strong person, a person I can rely on.
So what happens to them is that there's another adverse event that happens that then they can't keep it all together, or what finally is the straw that breaks the camel's back with people like that?
Oh my goodness. I would say it can vary a lot. So yes, certainly an adverse event can be a trigger for that. Other times, what we know about that is sometimes that's just not sustainable. So even without an adverse event, sometimes it's like, their sack of potatoes just gets a little too heavy. So even, they weren't getting enough sleep for a period in time. That's not an adverse event in itself. Maybe they were just having a hard time with sleep or they weren't eating enough. And gosh, just those basic needs are so important to meet. And your load feels a lot heavier when those needs aren't being met. So I think it could range from an adverse event to, sleep impairment or something as basic as that.
So if we are, as a parent, and I am a parent of three kids plus two, wonderful stepkids, how can I What sign should I be concerned with in my children?
Right. Yes. So my key go-to on that is we are going to look for any change from baseline. So if we were talking a little bit about eating and sleeping, if your kid is a great sleeper who all of a sudden is up all night, a red flag. But if your kid was always struggling with sleep, then, a few nights struggling with sleep is not as much of a red flag. Similarly, if you have a very picky eater who's not eating a ton, that wouldn't necessarily raise a red flag. But if you had a kid, a robust eater who loved breakfast, lunch, and dinner plus snacks, and then all of a sudden has gotten really picky or just says they're not hungry, red flag. So changes with eating and sleep, as well as things like interest in friends. Maybe you had a really social kid who loved having sleepovers, all of a sudden not so interested in it. Okay, that's a big change from baseline. It would make me curious about what was going on there.
And if you want to be curious because you're like, huh, okay, this is triggering something in me right now. What is the first thing that they could, as a parent, do if you notice one of these key? They're not sleeping well, they're not eating, they're not with their friends. What's one thing that you can do?
Yeah. So I would say the number one thing is start with your stance. Take a curious stance. Don't accuse them of anything. Just really wonder. And if you're going to make a comment to them, approach it from a place of curiosity, like, huh, you normally love my spaghetti and meatballs. Did I do something differently? And, this is like something that is very easy for them not to take personally. You're making it about you. You're staying curious. But yes, that could just be one idea, but there's much more.
Well, and we're going to come back. We're going to take a quick break, but when we come back, I'm going to take you there, everyone. How do you know if potentially your child has been traumatized? How can what can you do? And how can you promote healing and recovery? We're going to get back to Dr. Melissa when we get back. So stay tuned and let's hear these amazing suggestions when we get back. This episode is brought to you by my very own labor of love, my most recent book, ReLaunch. This book is a collection of my stories, other stories, and is a motivational guide to living a new 3HQ lifestyle, sparking your heart to ignite your life. It's available for purchase via Amazon. Get ready to try on the 3HQ method that I've been using for years throughout my entire life, reaching the next level in all areas, both professionally and personally. Get your copy today at www.therelaunchbook.com. Hey everyone, I am here with Dr. Melissa, and we now are going to go deep into has your child been traumatized and how to know and what to do to promote healing and recovery, which, by the way, is her new book that is in pre-sale. By the time you're hearing this, it's going to be out. We're so excited about that. But Dr. Melissa, you said something as we were about to take the break, and you said that it's really important as a parent to not be defensive, but be curious.
Mhm.
Be curious in how you ask them. And I loved what you said in terms of, I always make this, and you loved it. You love my meatballs, you love my spaghetti. And then they're not eating. And so give them an opportunity to not give you the yes, no answers, right? That's so important. But let's go back to this, what you wrote your book on, and that is, has your child been traumatized? What if you're a parent and you're like, I don't know. I don't know. Has he or she been traumatized?
Right. Absolutely. So, oh man, this is my topic. So, after an adverse event, I will say I get many calls. I field so many calls every year from parents whose child has experienced an adverse event, something that has the potential to traumatize. They are very insistent on bringing their kid in. I meet their kid, and their kid is totally fine. They were very resilient. They were not traumatized, and parents can't understand that. But this was so terrifying, and it was to them. And to their child, not necessarily the case, or maybe it was scary and they healed and recovered naturally. So I will say that sometimes after experiencing adversity, that your child will go on to heal naturally. Other times, after an adverse event, a child may have some post traumatic stress. Sometimes this resolves on its own, other times it doesn't. I tell parents the time to come see me or another therapist is if you notice that your child's stress symptoms are interfering with day to day life. So, interfering with them focusing at school, having get togethers with their friends, sleeping and eating, with functioning at home. So, if these things are being hampered and this has been going on for a bit, then I would say that's the time to bring them into therapy.
And so it's the stress symptoms when you notice that. And once you do notice,
Mhm.
um, are you saying that therapy is the only way to go, or do you offer other tips? Again, there's a point where you got to get to a therapist, but
Yes.
help parents understand when is therapy a must versus some tips that you might have to help.
Yes, absolutely. Okay. So if your child is experiencing suicidal ideation or self harm ideation, if they want to hurt themselves or they're thinking about ending their own lives, no question about it. Absolutely. They need to get into therapy. And I would even say if it's a question about their lives and their safety, you don't want to wait on some therapist wait list or even wait a week to get them in. You can call 911, you can call a local crisis outreach team, a mobile crisis outreach team, even that might come to your house for you. So, I would say that is something that even more quickly than therapy needs a response. But also if you're seeing major misbehavior, so if your child is hurting siblings or destroying property, punching holes in the walls, kicking the family dog, things like that, yes, we immediately need to get into therapy for that.
Mhm.
Also, high risk or impulsive behavior. So, we talked a little bit about self harm already, but other things like high risk sexual behaviors, drug or alcohol abuse, things like that, that would tip me off that therapy could be really helpful. If it's sort of like smaller beans issues, so if we're
Before
seeing,
we go into the
oh, go
small
ahead.
beans,
Mhm.
having two daughters and lots of friends and different, I've definitely, I've definitely heard many, many, many stories about self-harm, cutting. And we just had a conversation around this the other day where my daughter said, "Hey, it's on the rise. More and more people are feeling like this is an option." And I don't I need you to help me understand the self-harm of, what's behind that when it has to do with their trauma. What are they solving for in doing that?
Yes. So again, like every other answer I've given you, it could be so many different things.
Right.
I would say, um, oftentimes it's to cope with emotional distress. So if they are cutting or burning themselves or something like that, for them, it's easier to feel physical pain than it is to feel emotional pain. So it's a distraction technique from the emotional pain. So that is commonly what I see. Other times I hear kids talking about feeling numb and they want to feel something. So that's another reason behind it. Other times kids will hear about their friends doing it in their peer group, and it's also a little bit of curiosity. So they might start to try that. So there are so many different reasons.
And there are a lot of things that kids are trying that as adults, and I hear about them and I'm like, are you crazy? But you have to say, you can't do that again. As you said, you can't, that's the craziest thing. No, you have to take it from that side of curiosity,
Yes.
of asking the questions, what do you think that how are they benefiting from that? What do they like about it? What is, why are they doing what they're doing, in the sense of, are they trying to get something out of it? And I know there was that whole thing around Robitussin and drinking a lot of Robitussin because there's alcohol and you can get a buzz. And then there's all these, like, how kids figure out these things. It's just, we all as parents are like, what? We hear about these things, but you you know so much more about, they're, as you said, a lot of times it's because they can't deal with it, and it gives them their own form of an out or a feeling, whether it's emotional or physical. So super fascinating. Okay, so now let's go on to, those are the big ones. That's when you know you need to get to a therapist. But what are things that you see that, what, you know, you can hear some of my top tips for those types of situations.
Sure, sure. So one thing I frequently see after a child has experienced an adverse event is increased emotionality and behavioral regression. So, a kid experiences something scary and then wants to sleep in mom and dad's bed. Or a kid, starts using a baby voice, things like that, or is just more tearful frequently. So, those are things that are super common after experiencing an adverse event. And what my number one tip for parents, and this is a very basic one, is more TLC. Give that child more TLC. Give them more love, give them more support. They're needing it. And then also remind yourself as a parent, because it can feel hard when your child is needing you more than they had. Just keep in mind, this is temporary. This is not going to be forever.
That is a great one, because a lot of times, especially when we may not think that the event was an adverse event, we might think that, you'll get over that. That's not a big
Yeah.
deal. We
Mhm.
have to be thinking from their perspective, and you have to give them the respect that something's going on, so that you have to be able to remind yourself. Give them
Yes.
that TLC, give them that
Mhm.
love, give them the attention, prioritize them. And I love what you said, that it too will, it will pass, right? This isn't
Yes.
something that's going to be long term. And then I know you have a couple more tips, so I'd love to hear another one.
Yeah, absolutely. So, gosh, so getting more specific with more TLC. So, my go tos, I have three of them. So, give them specific labeled praise. So, when they're doing something that you want to see more of, let them know that. So, like, oh, wow, Jane, I love how you shared your colors with Tommy. That was so nice. Thank you for that. Just specific labeled praise. And then also, um, let them know you're paying attention when they're doing other things that are more neutral. So just describing what they're doing. You're really like loading them up on positive attention. And then when they do things that are not as desirable, so maybe they start talking back to you or something like that, using something that in the field we like to call selective attention or planned ignoring. So you're heaping on the attention when you're seeing behavior you like or behavior that's neutral. And when we see this minor misbehavior, we're using selective attention. So those are, I love
Those
those.
are great. So it's specific praise on things that they're
Mhm.
doing well, and it's to let them know that, you're paying attention by praising them, even when it's a little something. You don't have to, and it's not, I don't hear that you're saying you got to go, oozy oozy. You just have to, you got to let them know you're there. Let
Yeah,
them
you're
know you're
there, you're
listening.
listening, you're attending to their behavior.
And then I love that planned ignoring.
Mhm.
Planned ignoring. So good. Well, I know that you have your book coming out, and it's a pre-sale right now. So for those
Yes.
listening right now, how can they find out more about this book?
Absolutely. So it will be available wherever books are sold. So wherever you like to get your books from, Barnes and Noble, Amazon, through my publisher, which is the Guilford Press. They all will be carrying the book. Also, feel free to check out my website, which is melissagoldbergmintz.com, or follow me on Instagram with the same name, Melissa Goldberg Mintz.
Well, Dr. Melissa, this has been so great. What a timely book. We are so excited to have has your child been traumatized? How to know and what to do to promote healing and recovery. It has to, like, timing is everything. And especially with what you were sharing about violence in the homes, it is perfect timing. I wish you all the best in terms of getting this book out there. And, there are those. I know how difficult it is to write the books, and I can only imagine this topic. It was probably heart-wrenching to you.
Yes, that, and at the same time, heartwarming, just recalling stories of resilience in kids and families and parents. So I think, you can't have one without the other. And
You know what? That is
yeah.
such a great way to say that. That it's, not only heart-wrenching, but heartwarming,
Mhm.
because you're right. And you've used resilience many times today, and it's so true. I think it's probably the height of what I share with ReLaunch, right? That there's got to be a sense of resilience. And as you said, there's got to be this, awareness. And when you can release, when you can accept, when you know that it wasn't, necessarily, it's not, as a young child, we take on the blame of it all. And you gotta shed that. So thankful for you to be here and enlightening us. Everyone, next week, I am going to be going deep. I am bringing Patrick back as a co host, and we are going to talk about all things Africa and the impactful lessons that came from that. You are not going to want to miss this because they are really crazy and impactful for everyone. So I'm excited to share. And so make sure, live now, love now, relaunch now. And when you think about how do I start, go over to the relaunchco.com and sign up for our free 3HQ workshop. See you next week.